Good morning, everyone, and welcome to our Opioid Reduction Registry webinar. While we're waiting for folks to join us, would love it if you could introduce yourself in the chat and either tell us what was really great about your summer or what you're looking forward to most with fall. I know somebody said it was like 56 degrees today, and that is beautiful. So please introduce yourself in the chat. We've got good numbers coming in the front door. We'll get started. Thanks, Elizabeth, and we'll get started here shortly. So welcome. Got some football fans in the room. It's good. Folks from all across the state. We've got lots of different climates. Football season. It's good. I know all the big games are starting this weekend. We've got a great variety of organizations, it looks like. So if you're just joining, everybody is introducing themselves in the chat and letting us know what was great about summer or what you're looking forward to most in the fall. And it looks like football has taken the top rank here in terms of Virginia excitement. Hopefully our college teams are ready to go and will have great seasons. Welcome. We're just at 100 participants. We've got good numbers today. We're really grateful for you joining us. And we'll give it 1 minute and get started. Well, good morning. Again, if you're just joining us, we're introducing ourselves in the chat and sharing what we're looking forward to. It looks like everybody's kind of fallen into the next season. What's got you excited about fall coming around? We got a holiday weekend, but welcome. We have folks from all over the Commonwealth of Virginia, and we're really excited about this call this morning. My name is Kathy Spangler, and I work at the Virginia Department of Social Services, and I am the 211 Contract Administrator. And so we're really excited for you to be here today for the Opioid Reduction Registry webinar to share some information. You know, 211 Virginia was established in Code of Virginia in 1984, and the 211 number was launched in 2006. And since then, every day and in times of crisis, 211 has been there for Virginians, providing information and resources from the largest human services resource directory that is curated across Virginia. Today, we're talking about the focus on substance use and opioid reduction. And we're excited about that. But let me give you a little bit of a backstory. In 2003, the General Assembly passed Senate Bill 1450, which directed the Virginia Department of Health to assess the best way to create an opioid reduction registry. We know that this is an issue across the Commonwealth. And so VDH did an extensive review of available resource directories and programs and services and reported back to the General Assembly that 211 Virginia, which was already established in code and provided 365, 24/7 services to Virginians and had already established a number of information referral listings around substance use and opioid reduction, that they recommended 211 Virginia be the focus for establishing an opioid reduction registry. In 2004, the Virginia Department of Social Services received a grant from the Opioid Abatement Authority to establish the Opioid Reduction Registry. We just received notice a week ago that we have received a second year of funding for this service as part of 211 Virginia. 211 Virginia is a contracted service, and our contractor since 2001, I believe, has been the Council of Community Services in Roanoke, Virginia. They are the only nationally accredited 211 service provider in the Commonwealth of Virginia, and we are really grateful for their leadership over the last 2 decades and for their attention to this opportunity to position 211 as a resource for Virginians to address the pressing needs around substance use and opioid reduction. So without any further ado, we want to give you background on the project, a status update on the project, and I will leave you with 2 specific things that I want you to think about. First, we need your help. We need your help to build this registry and make sure it is curated of publicly accessible resources for Virginians. And we will also, and I failed to mention that in FY26, we've received additional funding to actually develop a clinical addiction treatment navigator as part of these broader resources and in partnership with 211 Virginia. So we're looking forward to a robust service here in the years ahead, but we need your help not only to identify great resources to have listed in the directory, but we're also going to need your support because we don't get significant funding to promote 211 Virginia. We count on all of our partners, both in the public sector, nonprofit, and private, to also amplify the benefits and services provided through the nationally accredited service of 211 Virginia. So without further ado, I'd like to turn it over to Amanda Holcomb and her team at the Council of Community Services, the Virginia Department of Social Services contractor for 211 Virginia. Thanks for being here today. I'll put my email in the chat. If you want to send me a note, please do. We're here to help you, and hopefully we can build this together. Amanda?
All right. Thank you, Kathy. And Kathy always does a good job setting the stage. So if we have anything, we might just be showing it to you again in slide form. But we are really grateful that everyone is here and that we have over 100 attendees in our webinar. We did switch to webinar format just because of how large our numbers are today. So we do encourage you, as Kathy already had you get started, to share your name and organization in the chat. This is a great time to connect with people across the entire state of Virginia. So if you feel comfortable and you want to put your email in the chat or your contact information in the chat as well, we encourage that. With the webinar format, we are asking you to put your questions in the Q&A that's located on the bottom of your screen. That way we don't miss it. What I think will happen today is that you'll have a lot of questions that will slowly but surely, not even slowly, we will answer during the presentation throughout. So then we can make sure, hey, if we still have this question, we'll get to it at the end and let everyone kind of benefit from hearing your question and our response. Today's session is being recorded, and also we will share the slides. I know we always get that, so we will send a follow-up email after this with all of that information. We'll also post it on our website. Just a quick look at the agenda. We're here, I think, for an hour and a half. I think we probably will take up that amount of time just to get to questions and answers at the end. But we will start out with just some session objectives. We'll learn a little bit about 211 Virginia. Kathy did a great, thorough job, but you'll see that. Again, we always say what we do is quite simple, but kind of behind the scenes is a little more complex. And so getting you kind of familiar with our system to then learn how it's being integrated with the Opioid Reduction Registry. You'll learn just slightly about Virginia's opioid response. We recognize that we are kind of talking to the experts in the room at the same time. So we have been kind of aware of that, creating this presentation. And then also we will do a look at this Opioid Reduction Registry, a pilot program, and some of the data behind what we've been doing these last few months. And then last, we'll end with how you can support our efforts by becoming engaged. And of course, listing, if you're not already listed, that is one of our biggest efforts. But then also promoting this ORR along with 211 Virginia. So our objectives today, learning about this opioid reduction registry designed to expand access to opioid-related support services, understand how the opioid reduction registry is being integrated into 211 Virginia, and then lastly, explore how you and your organization can support this effort to increase access, awareness, and ultimately recovery for individuals and communities affected by substance use and the opioid epidemic. So this is what we like to refer often as the 411 or 211. We have a much longer presentation. If you're not as familiar with 411 or with 211 Virginia and are interested in that, I will at the end give you our information so you can get that session. But this is just a few snippets from that training that we do offer. So 211 is an easy to remember 3-digit dialing code connecting with people throughout Virginia with local resources, also throughout Virginia. So that's nonprofit, it's government, it's faith-based, it's for-profit services. We are the largest health and human services resource directory throughout the Commonwealth. We're free, we're confidential, we are 24/7, 365. No matter the time, the day, the holiday, 211 Virginia is always open. And then there are many ways to connect. Our most popular one, it's in our name, is by dialing 211. For out of state, we do have this 1-800 number, which is really critical for our areas that kind of have boundary states around them, along with if you're helping someone in Virginia, but you live in another state, our 1-800 number is really important. We also launched text messaging a few years ago, which is rising in the ranks of how people would like to connect with 211 Virginia by just simply texting 24/7 211. We have live chat and email, an intake form that is available on our website. And then we have our public resource directory where you can search for resources also on our website. We have some language access using a third-party language translation service that offers over 240 languages. And we do offer within our contact center bilingual Spanish community resource specialists that can also provide live translation services for our Spanish-speaking population. As Kathy mentioned, we are a contracted service of the Commonwealth of Virginia. We always like to remind people that we are your statewide information referral system, and we would encourage Virginians and our communities to utilize us. It is administered by the Virginia Department of Social Services in partnership with the nonprofit that I'm employed by, the Council of Community Services. We were established in the Code of Virginia in 1984, and we've been doing information referral for a very long time, 3 decades, but we launched this official 211 number and that 211 brand in February 2006. So we are going to be celebrating our 20-year anniversary as a 211 in Virginia. We have a directory of over 15,000 programs across the Commonwealth and beyond. We're a nationally accredited referral source, so we are that only nationally accredited referral source within Virginia. And we are a member with that 211 network as part of United Way Worldwide. And we also participate in the 211 National Data Platform, which is essentially even bigger resource directory that all the 211s across the country, across the United States, a lot of them do participate and share their resource directory data. The structure of 211 Virginia, we aren't the gigantic call center. We are very local. We are Virginians helping Virginians. And so this is just kind of showing you our scale. Within the program of 211 Virginia, we're under slightly over 40. And you can see the majority of our staffing is within that contact center, or what a lot of people would refer to as a call center. You can see that then we have 5 people within our database team, and then 5 people within our community engagement team. And then within our leadership team, we have Margaret Telsch-Williams and Robert Morrow, who you'll also meet today, who oversee the 3 of these teams. So one thing we just like to say is that we are part of this critical resources working together when it comes to knowing your numbers. So as that 3-digit dialing code, we also join our friends at 911 and 988. I think a lot of people, especially when we're talking about substance use, are going to be interested in how we do work with 988. And so we'll, in the next slide, you will see that. But just to remind people that 911 is that first responder, medical, fire, crime, disaster response, life-threatening situations. And then 988 is really that intervention and crisis support for mental health, emotional distress, and thoughts of suicide. And then 211 is kind of everything else. We like to say, if you don't know where to turn, turn to 211. And we pretty much have a very comprehensive directory of all of those resources that you see throughout the Commonwealth. Most popularly, people contact us a lot for their basic needs. But one of our initiatives, of course, with the Opioid Reduction Registry, is people to contact us for those other needs, such as substance use and mental health issues as well. So a look at our 988 partnership. 211 Virginia does have many state and federal agencies, mostly just one, but a lot of our state agencies do contract with 211 Virginia. We partner with the Department of Behavioral Health and Developmental Services for 2 different initiatives, and one of those is 988. And so just wanting to highlight that contracted partnership that we do have with them, which includes data sharing and a warm transfer agreement. So they have access to that national data platform that we were talking about previously. So they have access to 211 Virginia's resource directory or our database. So they can access our agency listings through an API to that national data platform. With our new, you'll learn a little bit about our modernization. With our new database, we also have the ability to have our API used directly to our local database, but we also have it for the national one too. So 988 can access that. That way, that enables them when they're doing their job, when they're doing direct referrals post-stabilization, they've talked to someone, they do not have to then say, hey, and we're going to now connect you to 211 Virginia. And we don't have to call someone and say, hey, and now we're going to connect you to 988. So this is really where this partnership is so critical. It's kind of minimizing someone's need to kind of go back and forth between us. So they have access to that resource directory that they can then look at it and provide those resources to them. So when we talk about expanding the opioid resource directory in itself, that registry, it's really important to know that 988 will also have access to that for their clients that are maybe reaching them first. And our warm transfer does still occur with individuals in crisis reach 211 Virginia. And now I'm going to pass it to our Director of Data Analytics, Rob Morrow, to go over just a little bit about our database and some of the numbers behind 211 Virginia.
Well, good morning, everyone. When we start talking about the database, probably the first thing people want to know, well, how many services do we have? The number that you see is the year-end count, because it does fluctuate from month to month. We have services that are available all year long. We also have services that are seasonally available. And of course, agencies, new ones start up, other ones shut down, programs come and go. So the number is, quite fluid, but around 1,500 plus is where we stand at the moment. They're broken up into 10 basic categories. When we talk about, say, basic needs, this is one of our larger requested areas. That is your food, clothing, shelter, utilities, transportation. And then, it rounds about, you can see that we do have mental health and substance abuse disorder as a specific category that we use. And you'll hear a little bit more about that when we start talking about RX. We're not talking about prescriptions. That's our code number for substance use disorder services. So there are about 5,200 plus agencies in the database at any given moment. This number stays a lot more stable than the services, but most of these agencies will have more than one service, but there are a number of smaller agencies that may only provide one service, like a food pantry. In addition, something that's very new to us, we now have a system where we're looking at the number of agencies, the number of services, as well as the number of sites. Something we did not have with our old database vendor. And right now we have approximately, the mid 8,000s in the number of individual sites that are in the database. Again, these numbers can be a bit fluid. If we have programs that are changing, that number goes up and goes down. So every time when we look at our database, it's a snapshot. It's really hard to graph because things come and go all the time. So to give me kind of an example, we tried to retool our basic needs example to substance abuse disorder services and mental health. Those are frequently done by agencies that do the same thing, such as Virginia's community service boards. So you may have an agency that has a central intake and assessment for mental health and substance abuse services. Those are actually two separate categories. And they may have other service listings that are connected with it. The number of taxonomy terms that are attached to an individual service really depends upon the service description and the eligibility. If there are different eligibilities, we gently request agencies to put in more than one service. And if you have an agency that provides, say, substance abuse support services, and they have a food pantry for folks, those would really have to be two separate services just because they are very different and are probably going to have different eligibility in many cases. So the Inform USA system, that's one of our other national bodies. They give us a taxonomy classification system, and we liken it to the Dewey Decimal System for nonfiction in libraries. It is constantly evolving. We get updates, somewhere between 4 and 6 times a year, and a lot of it is timely. So if there is something new happening, like we did when COVID first came around, we did not have a COVID search term before the COVID epidemic, but they created one very quickly because that's what we were getting lots of calls on. Next slide, please. So just talk a little bit about what we do. You'll hear us talk about inbound contacts. Those are the number of folks that call us. The handled contacts are the ones that we were able to respond to. A handled contact simply means that we were able to answer the call. Sometimes people do hang up. That could be for long wait times, which do happen occasionally, but it could also be, the doorbell rang while they were, waiting to be routed. If we have an open person in our contact center, it takes about 30 seconds for a call to route. So it will work very quickly. It just depends upon the amount of demand that we have at any given moment. And then, from those contacts that generated, a large number of referrals, for last year it was 2,888, 822. And this is kind of how it works. So a person will call with one or more needs. We also document the needs numbers, not included on this one, but it's generally a bit higher than the number of people we spoke to. Some calls do not have a need. Those we refer to as information calls. So if someone knows exactly what they're looking for, like I need the number to Richmond City Department of Social Services, we don't really consider that a referral. We can give that information. They knew what they needed. And those are also very quick calls for us to wrap up. And then each of those needs will generate one or more referrals. We try to give 3 referrals, so there is an slate of options for folks when 3 referrals are available. And some of our services, and some of them are quite heavily used, there may only be one statewide resource. So it just varies, but generally speaking, that's what you'll see. The number of callers will be the smallest number. The number of needs is a bit higher, and then the number of referrals will be higher still. We also document when we cannot give a referral, and that could be for various reasons. It could be that the person is not eligible for any of the referrals. Usually that's based on income, though not always. To give you an example really quickly, back during COVID, we had some COVID relief funds that were for rent and mortgage assistance. Those had very high income levels compared to what we normally deal with. So we had a lot more one and done referrals that we could give for that. But that was a temporary program. It no longer exists. And so we do get some. Sometimes it's because there is no referral in the area. Our largest unmet need ratio wise is almost always transportation services, since there are many parts of the Commonwealth that do not have transportation infrastructure. To look at where the contacts come from, whether they're phone or text or chat or email, those are our core primary. Most of our traffic comes from the southeast and the east central, and that is the Richmond and surrounding areas, all the way down to South Boston. And then after that, we see northern, and then southwest. West central is the other part of the middle of the state, which is Lynchburg, Danville, Martinsville, that sort of triangle. And we do get out of state and occasionally folks that give us zip codes that are not correct. Everything in our system is meant to search by the zip code. And sometimes that can be cases of people giving us a PO box zip code, which is not searchable in the national database from the US government that we use. So, I mean, we do get some from out of state. You'll get people that are calling because they're relocating to Virginia, calling on the behalf of a family member that's in Virginia. So there are all sorts of reasons of why we may have some out of state. We also do border, North Carolina, Tennessee, Kentucky, West Virginia, and Maryland. And if you're very close to those borders and you're calling on a cell phone, you may get a Virginia tower. And we can give the folks the information on how to contact those 211 systems in the surrounding states so that they can get the information they're looking for. Just to give you an idea, our largest age group bracket is 31 to 40. It's followed by 60 plus, but that is a very wide range because we do get people whose age is documented up to centenarians. So that's quite a large bracket there. But this is currently how we have it sliced and diced. Next slide, please. So just to give you a couple of things, and Amanda's mentioned this, about 83% of our Spanish contacts are handled by live bilingual staff. The others, and because we do not have 24/7 on this particular service, so it's in the evenings and the weekends. If there is, some of all of our folks rotate weekends, so we might have a bilingual staff person. If it's not available, they will go through our translation services. We also do follow-up, and those follow-up contacts are, calling back for folks that are in critical situations that may need to, us make sure, did the referral work? Do you need additional resources? Sometimes you can get calls where folks have, multiple things that they need as you get to discuss with them what their needs are. And so we will follow up with some of those folks if we can get them. I mean, we live in the age of cell phones. It's not as easy to do follow-ups as it used to be because most people with cell phones don't have caller ID. And if they don't recognize the number, they may not, answer that follow-up. So it's a constant challenge for us these days as technology marches on. We also do some quality assurance surveys. We actually have two ways that we do this. One is primarily through our emailed and texted referrals. They get a link to the survey and asking how did things go with that particular contact with our contact center. We also just restarted something that we did last year, which is doing some automated follow-up requests to see how their experience was with the referrals. Gives us some limited data, but we can take a look and see what is happening. And we do find over the last couple of years, we've seen the number of responses. I didn't contact the resource go down. That's why I often call 211 the canary in the coal mine, because when people start having challenges, as has been the case for the last couple of years, we generally tend to see those numbers go down. At the same time, we've also seen more agencies that have waiting lists, which get self-reported through that system. Since launching the new website, we've got the number of visitors and users. So that it was relaunched in February. Brand new website. If you haven't been there, I encourage you to do so. Lots of stuff on that website. And home and community resource pages. Amanda, let me make sure I've got this correct, because this is not usually my bailiwick. These are the service lookups on the website, correct?
And they're the entry points to the service lookups. Yes,
Okay.
we'll get public resource directory data soon. We don't have it yet, but those are the entry points to the access to our search directories.
So again, it's brand new website. I use it all the time, but I'm trying to look up something really quickly. And it is mobile friendly. Just want to put that out there. So next slide, please. So just taking a little bit about more specifics in the service directory that we have. So we have 2,000, sorry, decimal point problem. I do that sometimes. 2,958 mental health and substance use disorder service listings. That translates to 449 that fall under that RX code for substance use disorder services. And we have 26 taxonomy codes that we do. We are constantly looking at the taxonomy number. And it runs from very, very general to very, very specific. And they're anywhere from 4 to 6 levels on that. We usually keep most of our services around the 3rd or the 4th level, but occasionally we find something that is of particular interest to the Commonwealth. So, for example, we are currently working on a couple of codes that we are making more specific, because harm reduction has been a big issue over the last few years. So we've moved down to a lower level that gets more specific, so we can look at harm reduction being, a specific service that is being offered across the Commonwealth. So if you look at the diagram, it kind of gives you an idea that you have substance use disorder, but it can be broken out into, comprehensive outpatient substance use disorder treatment, transitional residential substance use disorder services, or assessments for substance use disorders. And there's, as I said, 26 total codes that kind of look at what we can frame each individual agency. And this is where we can look at what does the service description say, and what does the eligibility say, and how should these be broken up so that they are user friendly for not only our internal staff, but folks that are coming to the website. Next slide, please. And this is kind of gives you an idea of where the codes are. So this is the entire list. I love the graphic. I want to call it groovy, but I mean, that seems very 70s, and this seems to be very 60s to me. But, this gives you kind of an idea where you can see some of what's in the database. We do have specifics for opioid detoxification. That's one that is popped up in the last few years that we've been working on, trying to make sure that we have everybody who does that specifically, since it's been of interest. But it runs the whole range, and I mean, this does include things like smoking and vaping cessation, in addition to all the others. So alcohol, drug use disorder, smoking and vaping cessation, as well as we have other addiction codes that don't appear in RX, such as gambling addiction. So next slide, please. I think this is my last one.
All right. Thank you, Rob. And just before we hand it over to Margaret to learn more about the Opioid Reduction Registry or to introduce you to it, I just wanted to give a nod to our modernization. If you are already a listed agency, hopefully this is not your first time hearing about it. If you've attended anything from us the last probably year and a half, you have definitely heard about it. One thing during the first year of our award, which we're still in, it's over, I think, at the end of next month, we have been going through a pretty significant modernization of 211 Virginia just to strengthen our infrastructure through that modernization and enhancing that system. And because we were going through that modernization at the same time as this opioid reduction registry, we were able to build it with the opioid reduction registry in mind. And so when we talk about this modernization, we are talking about a new website, a new public search tool, and a new database platform. So we did introduce new software vendors, new training of our staff, and then of course putting out all of this to our agencies and the general public. So this has been a huge project for us, but a much needed upgrade for 211 Virginia. We are operating out of our legacy system for over 10 years, and as you all know, technology is ever rapid, and so we do keep up with it, but this was really giving us this chance to really make something great and to improve an already good system. And so we're going to continue to modernize and build on this foundation that we have built in the first year. But I did want to acknowledge that and just kind of show you what we're talking about. So with our new public resource directory at that search.211virginia.org, it does have this little guided search, a how can we help widget that has a drop down that if you don't put anything in it, you can select. So we were intentional not only to put in our basic needs, but also add in the substance use. So I need help with substance use. From there, that links to those relevant taxonomy terms, RX codes that Rob was talking about. So when you just click substance use, it will take you to kind of everything. And so you'll see those listings here, or those specific terms here. And then you can go down even farther by searching your city, the state, Virginia, and then your zip code for there. You can also get more specific in your search if you're looking for anything specific that's tied to these searches. You're able to do that, and you're also able to search organizations and programs. Also within the public search, both on the homepage of 211virginia.org and the homepage of our search.211virginia.org, you will see these 12 public search categories. And so we did feature mental health and substance use under one category. So you'll see on our top row that we did put utility, housing, and food, our most requested categories. And then we have under each one 5 to 6 subcategories. And because we know that a lot of the language, especially around taxonomy, is very technical and not especially user-friendly, especially when we're talking about the public searching for resources on their own, we did try to use common language when we're naming things as best as we could. And then they're coded in the background with our taxonomy terms. And so you'll see the 5 to 6 subcategories that we selected for mental health and substance use include community service boards, counseling, crisis care, inpatient treatment, outpatient treatment, and then kind of that overarching substance use. And as I showed you before, we'll then break it down farther within those service listings based on the taxonomy. Now I'm going to pass it to Margaret Telsch-Williams. She is the Director of Information and Referral Services at the Council of Community Services and oversees the 211 Virginia Contact Center and does a whole lot more. So Margaret, take it away.
Thanks. So yeah, to get into like what we've been able to do for the opioid reduction registry, we have to start with just some very basic background. And I know most of you are experts on this, so we'll go pretty quickly. But just for the background's sake, the Abatement Authority started in 21 based on the General Assembly really like looking at the settlement funds that were coming to Virginia from the prescription opioid manufacturers. And by creating the Opioid Abatement Authority, they're able to, form the grants and donations and other assistance, kind of for the Commonwealth, so that agencies that understand this work can do this work with the financial support. So you can see their option to subscribe to the OAA's mailing list. You can also check out their Abatement Academy, where they've got a lot of good webinars and things like that. So from the Abatement Authority, we get to Virginia's opioid response and what's been going on with that. And by throwing money at this problem, for lack of a better word, we've seen change. So there's been declines in drug overuse or drug overdose deaths from 23 to 24 by not quite 50%, but 43% decrease. But we're still seeing that, opioid use is still very much a crisis and a very serious public health concern. So some of the successful programs you can see on the right side of your slide here, these are things that have positively impacted the opioid epidemic. So that naloxone access, those trainings, harm reduction, anything you can think of that has kind of popped up, it has been effective. And we've seen those types of services increase through the OAA's work. It's also, giving us an eye that, well, now we need to make sure we're connecting and expanding access, really creating awareness of those types of programs through, all the prevention, treatment, recovery, etc. So if you go to the next slide, that brings us to where 211 kind of fits in with this puzzle. So it was decided in 23 that the General Assembly said, yes, we really need an opioid reduction registry. We need a one-stop shop, for lack of a better word, of where to find resources. So they agreed that that was something that we needed, but there was no money attached to it. They did ask Virginia Department of Health to figure out how a registry might work. And Virginia Department of Health came back and said, 211 already has this type of structure. We already function as a call line. We already function as a database system. It's just about motivating to get all of that opioid listings together in one place. But again, no funding was attached. So the Council of Community Services and BDSS worked together to really try to track down the funding. We were able to secure the Opioid Abatement Authority funding and get us set up to really run this registry. And our funding started, it was granted October of 24. So not even a year ago, we were able to really nail down where the funding was going to come from and get to work and get started. So go to the next slide. So with the registry, we viewed it in a number of ways. We know we want to provide that resource, kind of be that hotline for people that are experiencing substance use disorder issues. So we looked at it in two phases. The first was very much internal. We needed to make sure we had good training. We needed to make sure our database was really robust. We were making sure we catch every one of those taxonomy terms that Rob was talking about. We wanted to run a quick pilot and just get a peek at some data. And we also needed to talk about agency recruitment. Who are we missing that should be in our database that we just don't have? And then our second phase, which we're starting to head into now, that we'll see a second award year this October, we really want to be able to start to push the marketing promotion of it, increasing our volume for calls, texts, and web. Just sowing the seeds that we are this resource and to tell people about it and to use us. And then we also have kind of this picture in mind of how we can build out our texting response so that we can provide more and more resources to people beyond just the contact center and people calling in. So if you go to the next slide. We looked at it and kind of broken up into 5 possible objectives. So the first was to just support this integration, get us up and running so that we can be that service. I feel like we're there. Now we're really working hard to partner with organizations. We have a goal to try to get 1,500 listings. That may be pretty lofty, but we're thinking about the whole state. So it's not just one region or one county. We want to catch as much as we possibly can that's available to Virginians. Next, obviously, the staff in the contact center needs to be trained. They need to fully understand the type of work that your agencies do. They fully need to understand how to talk to someone who is struggling with substance use disorder. The texting platform I just mentioned that we're wanting to build out is a piece of that. And then we hope to see that we're able to help 1,000 or 10,000 people, what we call inquirers. It's anybody that calls in, texts, chat, emails us. We really have a goal of helping 10,000 people in 1 year. So those are our benchmarks of where we're headed. If you go to the next slide, we started to look at how does this look, on a calendar, basically. So first, we're definitely going to need protocol and training creation. We wanted to run a 3-month pilot. We're in that pilot now. Then we're going to look at data. Obviously, data drives most of the things that we do because we are capturing data on every contact. And then also agency recruitment is a piece of that. Of course, it's one of the reasons you're in this session. And then going further to marketing, education, outreach, and letting people know about this service. So if you go to the next slide. That first piece, protocol and training creation, we didn't just make it up as we went. We collaborated with Steve and Wade with social services to identify what trainings would be best for our staff. We aren't sitting face-to-face with somebody. We're usually on the phone or texting with them. So we identified, using Recovery Ally and SBIRT, which is the screening, brief intervention, and referral to treatment. So making sure that we captured those trainings for our leadership staff and then building them into our learning management system that we use through Inform USA. We also wanted to make sure we had quizzes and things like that for our staff so that we can catch any deficiencies they may have before we release them onto the phones to assist. And then next, we also wanted to make sure we had a protocol in place. I'm a huge believer in having it written down. So we needed to make those protocols and then provide as much information as we could to staff that were actively on the phones so that they had something like a SharePoint page and screen pops that would show up for them when they're on these calls so that they didn't have to memorize everything. It's more of an open book test on every call. So if you go to the next slide, it'll kind of break down like what our pilot was looking like. So in that period of time before July, we were training and building those protocols. And then we selected 5 of our community resource specialists to be in the pilot. So they then completed all of that training, reviewed protocols, learned it prior to July. When July came, it's the beginning of our quarter-long pilot. July came and we didn't change anything about the phone system whatsoever. So everything routes the same. People are calling 211 for some need. They haven't heard about us as a substance use service. So when those calls get routed, if they go to one of those 5 trained specialists, we had them ask a simple question, let them know that we're providing resources on substance use. Would you or anybody that loved one, would you be interested in receiving any information today? So very simple question in the midst of what they actually called for, whether that was rent or a food pantry, but it's awareness and followed with an offer to help. For the other 22 specialists, which makes up not quite 80% or a little more than 80% of our staff, they didn't ask this question. They didn't touch it. So they're kind of our control group, so to speak. And then because we're running this for a quarter, we still wanted to have a peak after the end of July. So when July was finished and we got into this month, we pulled all of that data and started to look. So the next slide, this is just for that July month. We can see the blue bars are our 5 community resource specialists, and the yellow bars is representing those 22 other people. We can definitely see 74% of the referrals came from those 5 specialists. So surely they made a difference. And then we definitely saw, that a jump for us was that 233 referrals were made. And that's just a big piece of, they weren't calling in for substance use, but when we offered it, made them aware that we had these resources, it looks like a lot of people took us up on it. So of that 233, if you don't know what it was previously, the next slide should help you with that. We were averaging about 68 referrals a month without the pilot. So people weren't necessarily calling in specifically for substance use, but the second that we started to offer that assistance, we saw an increase dramatically go up. So from January 1st of this year to the end of July, we've totaled at 675 referrals. But we know a massive chunk of those came just from the pilot. We can see it spread out across this year. So we really affected change. And that's with just 5 staff members offering assistance. If we had every staff member offering assistance, we would have dramatically seen it go up, I'm sure. So we definitely had a surge there. And then to break it down even further, next slide, we can say that it wasn't just one type of service that did this to the numbers. It was really spread out across the board. Here's some of our top ones. So everybody tilted up in July, which is pretty reassuring to me that there's a wide variety of need from a wide variety of people. So it wasn't just that suddenly one type of referral went up, but everything else was down. So we found that pretty remarkable, and especially just to know that people do want the help, that they do want the assistance when it's offered, when they found out that it was available, is really nice. So the next slide. When we broke down the data of who was asking for help, it was interesting that our largest group affected was 19 to 30-year-olds. Of those that received those referrals, followed by that 31 to 40. And as Rob said, 31 to 40, we know historically for 2-on-1 is our highest demographic and age range. So it was interesting that when it came to just substance use, when we looked at who was able to take the help and wanted resources, it actually skewed a little bit younger. So this could be like our new workers, college students, new parents, that kind of thing. It's pretty interesting to see. So we're looking forward to further data where we can kind of break that down even more. And then when we looked at the localities themselves, we're really still across the state. We saw Richmond and Henrico County as the very top, followed by Fairfax, but also Roanoke and Lynchburg were in there. So, I mean, we're really seeing that it's kind of anywhere you can think of. No one pocket, stood out across the map. And the next slide. Looking at the top 5 programs that we referred to, one thing I found really interesting is that it obviously is heavy on treatment itself, wanting a facility, whether inpatient, outpatient, or residential. But also on the flip side of someone wanting treatment, we saw an increase in people that were looking for a hotline or wanting just an assessment, like wanting to know if this was a problem. So I found that very interesting. And it's perhaps because we're asking this question that somebody goes, oh, I'm really not sure if I need help. So I liked that to see that this top 5 was such a good variety. And then lastly, one of the things that makes 2-on-1 Virginia so great is that we're everything about data. And so even when we can't help someone, we track that too. So reasons that we didn't have a referral given. In July, we gave out 233, but there were 5 times where we didn't have anything. So we track why. So we saw one instance, they just weren't eligible for the service for whatever reason. The next was there was no referral available in that region. Sometimes that happens in a rural area. And then lastly, just listed as other. So we could do a little bit more digging if we wanted to see what other means in these individual situations. But so it's very reassuring to see that the majority of the time we were able to provide information. So just my assessment from the pilot and kind of how it's going is that we were able to absolutely affect change in the fight against addiction. And this is just in a small controlled, 5 staff asking a question environment. So I can only imagine what we can do when we've got robust, database listings matched with advertisement and promotion. So next slide. So our next steps internally, because I'm contact center side of things, we want to build the phone prompts up in our system so that it comes across when somebody is selecting what they're calling for, that hearing that we provide substance use services is available is an option they can select. We may see an increase in our numbers there, but to do that, we want to train more staff. Because we are 24/7, we want to make sure that every person on 24/7 is able to handle this type of call. We also want to provide agentless assist messaging. When we talk about agentless assist, it's instead of a live chat, it's more of a call and response where we've got some stuff set up to automate. So we can direct people to our website, to substance use information, just through a simple text interaction, but it doesn't take a contact center specialist to help them. And they also want to look at automated referrals. So this is further down the line, but what if they could just have complete anonymity and not have to talk to anybody? Because we know that could be a deterrent. The idea of making a phone call could be very scary. So if they could text in and get referrals sent back that's completely automated, we think that might also help affect some of this change. So, and then of course the agency piece, which Amanda will cover, which is so crucial to us providing resources at all, is having agencies listed.
Thanks, Margaret.
Yeah.
So one of our biggest focuses, as you have seen, is agency recruitment. And one thing to note that if you're here just because you're interested and you don't maybe provide a mental health or substance use service, but you are still providing health and human services, please know we still also want to list you in our directory as well. We are always looking to add new listings into the resource directory because while our unmet and no referrals given is low, we still want to make sure that we have as much listings to refer to make sure that we can meet those needs when they happen. So with the Opioid Reduction Registry, we are prioritizing right now within our community engagement team and the whole Team 211 Virginia, identifying, recruiting, and then listing of substance use related services across the Commonwealth. So as you saw, we kind of given you the background, and now it's really how you can be a part of this Opioid Reduction Registry. We are starting at that 449 specific substance use listings with that goal of 1,500. And so one of those objectives is, of course, to get to that number of 1,500 program listings. How we're going to do that is to hopefully recruit those who are not listed to join our resource directory. And so just some quick benefits of adding your organization to 211 Virginia is that it's free. There's no cost. We're not asking you to pay for your listing. We are asking you to voluntarily list with us at no cost. Increasing your reach with the efforts behind the Opioid Reduction Registry and then our 211 general services. We really want to expand your impact, making sure that you're in the directory so we can connect individuals in need to the services that you offer. Oftentimes when you don't know where to turn to 211. We do field that first call initially and hope to reduce the burden on service providers, cutting costs associated with managing your own resource directories, your own information referral systems. We know that they exist throughout the Commonwealth, but if it is something that you're doing that, hey, this is really really hard to maintain, we don't have a staff person to maintain it, the information is kind of forever turning over or out of date, we encourage you to kind of leverage us instead, or kind of not just a and or, but a both. Also, if you're having those type of resource directories, to also list 211 Virginia within there to say, hey, not finding what you're looking for, want a little more support, contact 211 Virginia. So we really like to say that we field the first call. And then by acting as that central access point, our hopes is that we're saving time for our organizations and for those kind of boots on the ground, those helpers, to really help the helpers have this go-to tool with 211 and the Opioid Reduction Registry to really call on. I think when we think about our professionals like social workers, emergency personnel, and government officials, they're often the ones that are going to be interacting and maybe don't have in their brain this thousands of agencies to refer to, but they can refer to 211. When we think about the ORR, this is really important when we reach hospital systems, when we reach clinics, when we reach our health departments, that they are aware that this effort exists and that they can utilize it at any time too. And we are a trusted resource. We have been around for a very long time, and we are 24/7, 365. We do collect some demographic information, but it's also optional and completely confidential at the same time too. To list with us, we also try to only refer to programs that are eligible. So we do, as part of your listing, collect pretty extensive eligibility. So we are giving those accurate referrals too. So you can trust that we're not just sending them because you're there. We're looking. Do you serve within the service area that our person in need is calling from? Do they meet your income eligibility? We can put notes on alerts that, hey, we don't have funding the rest of October, but come September 2nd, we're back in business. So we really do try to keep those listings accurate and up to date as much as possible to give those appropriate referrals, to be that trusted resource for Virginians, but also to those agencies who list with us. So to list your services, the first thing we kind of ask you is to make sure you're not already listed with us. You would be surprised, because we have been around for a very long time, that you might still exist within us. So just kind of check. You can check with our team. You can also check using the public resource directory or on the update your agency module by just kind of typing in your name. Some of it is very specific, or if you've had a name change, we certainly would want to know about that too, but just making sure that you're already not listed. The second thing we ask is that you just review our inclusion policy, which outlines that eligibility for programs and service listings. As part of our accreditation that you heard about, we do have kind of an inclusion policy that we'll look at shortly of who we're looking to recruit in. Of course, with the Opioid Reduction Registry, we would like to list all substance use services that are eligible. And then if you meet our inclusion policy, we encourage you to submit a resource inclusion form. You can do that online. You can do that with our team. We can connect you with a community engagement team member or a database team member to get you listed. Your request then, once you list, will be reviewed and entered into our directory, and a member of our database team will contact you to confirm it, also to, if they have any questions for you, or to review your listings together. We can provide that technical support. So who we're looking for in the inclusion policy, our inclusion policy is much longer than just 6, not actually too long though, but this is kind of the gist of it when it comes to the Opioid Reduction Registry, is that we want your agency and service to provide a human service, so something that we can refer humans to, a health or human service. And then of course, being in Virginia, the agency and service provider must serve residents of Virginia, knowing that we have those neighboring states, especially when we think about far Southwest Virginia and Maryland. We know that some of those agencies probably are in between. We know that there's a lot of coalitions that kind of serve both too. So it's okay if they're an out-of-state agency as long as they serve Virginians. And then we do prioritize those that offer services free or low at cost. And then we're also looking at where our gaps in services might be, and really looking to prioritize those who maybe, when it comes to our unmet or not referral given, prioritizing those services. With that said, it's not just nonprofit, faith-based, and government. This is also for-profit. I think when we think about the mental health and substance use services, that's really important to say that if your for-profit offers Medicaid, Medicare, sliding scale, or some other low-cost options, we will list you within our directory. Where we won't is individual practitioners. So we could list all day thousands and thousands of physicians and psychiatrists and private practice, but we aren't that. We would rather have kind of the groups, the medical groups, the mental health groups, the substance use groups. If you're a private practitioner within there, we will likely list your group rather than you individually with that practitioner. And because we are talking about mental health and substance use, there is often licensures and credentials that are required to legally operate the service. So if that is the case, and an organization is not licensed, and they are not eligible for the directory. We know a lot in this work, grassroots efforts work, if they are kind of informally offering services or more grassroots and haven't established their 501c3 status or aren't a for-profit organization, they probably aren't eligible either. And then the other note we just want to make, organizations that exist solely to serve the clients of another service provider, those are really, really important, especially when we talk about maybe someone at a CSB that just has a relationship and only accepts referrals from them, or someone that's within social services that only has kind of a contract referral with them. We wouldn't put those in the database necessarily because they already have a referral route directly. A good example when it comes to outside of the ORRs, like churches, who would maybe only serve their congregation members when they need help. We wouldn't list them within the database. So to read that full inclusion policy, you can go to our website and look at agency resources and then the update and add your agency. The biggest thing too is if you're already listed, we encourage you, now that you've kind of learned the full scope of 211, the taxonomy, how we refer, what types of programs we refer to, we really encourage you to review your listing to make sure all your services are listed accurately. And also consider if there are any missing sites. So if maybe we're missing locations, you have a location in Roanoke, but you also have one in Hampton Roads, but we only have the Roanoke one. Let's make sure we get the Hampton Roads one in too. If you have services or that service has more than just the zip codes or the counties and cities cited in your listing, let's make sure we expand that out too. So we really do encourage, if you're already listed, to have access to your listing and then just review it with this opioid reduction registry in mind if you do provide mental health and substance use. Our database team, as we said when we were going through modernization, has done a great job reviewing, adding more taxonomies, so then we can give that best referral. But if you see anywhere in your services offered, like, hey, this is under a really big umbrella of a program, so maybe we'd get better services if we individualize some of these instead of putting them as one. So we can certainly look at that and work together with you to look at your listing and how it's going to generate the best referrals, both on our public search, but also within our contact centers. And then we just ask you, it is a requirement to be listed to at least, at minimum, review your listing annually. We would like you to let us know anytime there's changes and keep it up to date all the time, but it is at minimum annually. To adhere to our accreditation standards, we do have to at least every 18 months review every single one of those 15,000 listings. So that is a big job for our database team to do, but it is very important to us to make sure that we are accurate and up to date. And then last, if you know of a service and you're not sure that they exist, you are welcome to search them in our public search or ask us. But if you have an agency or a service to recommend, we definitely want to hear from you. Suggest agencies, services, new locations that can be added to the ORR. Help us identify gaps in coverage for specific services or geographic areas. Now that you've seen the data, we might do a follow-up with some other data pieces too. But if you see, hey, when you're talking to your community engagement specialist, do you have this, or you might not have this service, or it looks like we really, in this part of the county or in this part of the region, could use more services, we'd really like to partner to kind of work on that to eliminate as much gaps as possible. And then share leads from your network or community contacts to expand the ORR. Our community engagement team is located throughout Virginia. They will attend your committees, your networks, your events. So if there's anything like that, we do encourage you to connect with the team, and you will get their information in a few slides. Just to know that your recommendations directly strengthen the Opioid Reduction Registry and improve access for Virginians in need. And then last, just help us amplify awareness of this effort that we're making within the Opioid Reduction Registry. We encourage you to share the information about 211 Virginia in the ORR with your clients, your colleagues, and your community partners. To train your staff and volunteers about 211 Virginia in this Opioid Reduction Registry, we have this 411 or 211 that I talked about in the beginning that we can offer. We do kind of a database 101, directory listing 101, and then we can also always do, we love to show our data, so data presentations and kind of quick presentations on how to become more involved with 211 Virginia. Highlight this work in your newsletter, social media posts, or at community meetings. Display and distribute our promotional materials, and encourage other agencies to list or update their services. Connect with our team to access those resources, training, and technical support. And then also, please visit our new website and check out the agency resources, data, events and training, community resources, and more. And as mentioned, during this modernization, kind of phase 1, phase 2, we're going to continue to build. So we do encourage your feedback. We know within this work, we are talking to the experts and the service providers. And it is important to us when we market this program, when we reach out to agencies, when we're part of these communities, that we are doing it effectively. So any feedback is appreciated. Oh, and my graphic is not showing up. We'll make sure you get that. We do. So now that you've heard about how to get listed, we are hosting a session in less than a month, on September 24th at 10 a.m. We'll send out that along with these slides and recordings. But we are offering kind of that database 101, decoding the directory. So if you're new or you want to update your listing and you're like, gosh, I don't really want to do it on my own, it will be a walkthrough of how to get listed. So we will be hosting that and we'll make sure you get that information. So I mentioned our regional team and our database team a few times. So this will go out, but if you want to just take note of who your regional specialist is, you can, and then also who your database curator. But these are the members of our community engagement team and our database team. If you're wondering, all the other panelist members today, they are the community engagement team. So I'll go to the next slide and you can kind of see where we're all located at. So we have Mary, who is in the northwest part of the state. She is your regional community engagement specialist. We have Darian, who is in our northern part of the state. And we have Brittany, who is in the southeast part of the state. And Nelson, who is part of our east central, so the Richmond and surrounding areas of the state. And then Lori is in our southwestern part of the state. And then right now, I cover our West Central region as well, and I'm based out of Roanoke, so I also serve a lot of the Roanoke area along with the state. So these are the people definitely to get in contact with. And then if you are listed or you're struggling with your listing, our database team members also kind of split up their work regionally too. So if you want to take note of their information as well, but it will be sent out to everyone. And then last, the presenters today, here are our information. If you would also like to capture that, we all kind of, we connect each other, we'll connect you with the right person. So there's really no wrong door, even when it comes to connecting with us, but this is also who you heard from today. So we do have, let's see, we have a good amount of time for questions. So we'll go ahead and look at our questions and then hopefully have some answers if we have any.
We've covered pretty much everything that was in the Q&A. So if anyone has any additional questions, you can go ahead and drop them in there now.
Amanda, this is Kathy. I just put something in the chat and really wanted to clarify for folks as we move forward, the Opioid Reduction Registry really is the listing of resources in our directory. Promoting to the public, we've already gotten some early testing that promoting the Opioid Reduction Registry causes some confusion among the public that we might be collecting their names and putting them on a registry. And so what we would encourage everyone to focus on is let's make sure that resource directory, the Opioid Reduction Registry component of 211, is as strong and complete as it possibly can be. But in promoting to the public, we're promote 211 Virginia as the resource to call for assistance on any substance use, mental health, or other related issues. We think that that's going to be the best way to maximize not only a focus on this issue, but also to get people, we find that we give 3 to 4 referrals out. And so people's lives are complicated. They have lots of different needs. And so promoting 211 Virginia as a resource in this way gives the team a lot more opportunity to meet the inquiries that are coming over the transom. So that's just a note. Want to make sure, terms of reference are always an issue. The General Assembly wanted us to create the Opioid Reduction Registry. We're doing that. But promoting 211 Virginia as that front door to get access to these services, we think is the most viable way to not cause concern that we're collecting any kind of information on people contacting the center.
Thanks, Kathy. Definitely. And we plan to have some promotional materials, as mentioned in phase 2, that are kind of specific to, hey, you can reach 211 to also get help with substance use. But right now, we also still have our 211 Virginia promotional materials that are general services as well. And then the data piece, I did see that question around it, and absolutely, we definitely want to share our data. If you go to 211virginia.org, you'll see at the menu, we do have data. The most recent planning district reports from 23-24 are posted, and we're going to keep those up. We are hoping to do some more data visualization and use data dashboards instead of doing these 20 to 30 reports each time, but they are really, really interesting and a really good snapshot of the data that we are capable to provide. So absolutely, I did see that question in there.
We have another question in the Q&A right now. Amanda, if you want to answer it. Do y'all have an outreach toolkit with social media posts that people can use to raise awareness? You want to answer that one real quickly?
So we have materials on the website, but not yet social media posts. That is on our wish list and things to do. We are hoping to create more promotional items that are more, not just evergreen, but also that you can use for social media as part of our phase 2 of modernization. So we do plan on working to get some of those within the year. Yes.
And I just want to add on to what Kathy was saying. Everything that we do as an accredited information referral system with Inform USA is voluntary. So both on the case of agencies and individuals that contact us, everything is voluntary. So people can remain completely anonymous. And we just don't go and raid the phone book and put a bunch of agencies in. So it is all voluntary. We do need to have the cooperation of the agencies themselves to get their information in and agreement so that we can list them. So just wanted to throw that out there. Everything is voluntary that we do.
I see an offer to list in your newsletter with the General Assembly member content that reaches over 10K constituents through delegate open chain. So we definitely appreciate that, Kaylee, and we'll work to get some of those blurbs too. So anything like that, we definitely appreciate, and also letting the General Assembly know, hey, this is an action too. What they voted on, what they approve, what they're helping fund. We really do want to know that their work is reaching their efforts are reaching the constituents that need the help. Any other questions? All right, I think
I don't see any more questions, but someone does have their hand raised. If you have a question, do you want to drop it in the chat real quick so that we can answer it? Or maybe they raised their hand by accident.
They might have. There's a lot of things you can click on in the Zoom, so. All right, and I put the back on the community engagement team and database team just for you to note our contact information. If you need anything, I do encourage you to reach out and we'll get you anything that you need and the assistance that you need to get listed or get updated. Otherwise, we'll probably just end the session and encourage you to reach out. We'll share the recording, we'll share the slides, and then we'll also share information about that September session if you want to join us through a walkthrough. But thank you so much for being here and supporting 211 Virginia in our efforts to impact the opioid epidemic in Virginia.